Okay, is everybody in the house? We have Todu Guam, Public Health, GHRI, Sanctuary, and West Care. I feel like we're pretty late right now.
I thought that was another. We may have told them to go to another.
Oh, that's right. We kicked them out. I forgot. We just wanted you guys.
Oh.
No, they're at the other session. So, but just so you guys know that you're at the right session, right? Because this is going to be on health. So we have Todu Guam here and Public Health. So a round of applause for Ashley Rodriguez. Say a wave. So Ashley is a community leader from Guam and an advocate for youth empowerment, known for her work with Todu Guam, the organization of Dreamers United. And we also have Christine San Nicholas. And what's that? Oh my gosh.
Yeah.
I know it's like it's been the throwback. I didn't almost recognize with the beard. It's only man. All right, it's great to see you. So I didn't get your bio, so we'll you both have the same bio. Christine is a dedicated public health professional with the Department of Public Health and Social Services in Guam. So just round of applause for our speakers this afternoon. So we for this, unlike today, we've been really panel heavy and just having conversations and discussion points. But as much as we're going to be doing a little bit of that today, we do have a slide deck available. I was going to start with Ashley, if you would like, if you're okay. Do you have Ashley set up first? Okay, great. Okay, so I'm handing the mic off to you. Wonderful. Is it okay with that?
Sure, thank you. Sorry, I think we're having a little bit of difficulty, so I'll just let you know when to scroll down. Okay, so good afternoon, everyone. My name is Ashley Calvo Rodriguez. I'm from the Todu Guam Foundation, and we are a locally and nationally recognized 501c3 nonprofit organization, and we are committed to getting Guam healthy, one man, one woman, and one child at a time. You can scroll down. And so our organization's name came from the Chamorro word todu, which means all, everything, and entire. And so the idea and the mission of our organization is to provide healthcare for Todu Guam, for everyone on Guam. Our mission statement is to address the health disparities on the island and promote health equity on the island by providing access to basic healthcare, education, and assistance to the island's underserved population. And so a little bit of background on how our organization got started. In 2016, former Senator Dennis Rodriguez Jr., who is my father, he was a senator in the Guam legislature, and he was the chairman on the Committee on Health. And so while he was in the legislature, he had a lot of work in policy, but at the same time, he had a lot of constituents who would come to his office and ask for assistance in ways that sometimes policy became a barrier. In the sense, there were a lot of students who were in the public school system unable to get into school because they couldn't afford the school physicals, they couldn't get their TB skin test because of school entry requirements and routine immunizations and the like. Additionally, there were a lot of disparities that he saw. As you guys are familiar, people are always looking for medical fundraisers to help support getting cancer treatment off island or getting specialty care. And so he saw that this was a big issue on the island, that policy and bureaucracy sometimes becomes a barrier. So he had a colleague of his, someone who was also working in his office, who is a military veteran. And he said, "Hey, I have this mobile clinic in the back of my yard that I bought on the military surplus. Do you want to come check it out and buy it?" And so I guess he went to his house, and I always tell people that this year my parents probably almost divorced because my dad came home one day and said, "Hey, I bought this car and I bought this new mobile clinic. And so on the weekends, we're going to go out as a family and have free mobile outreaches." And a little bit of background on our family: none of us were in the medical field. I think I was still in high school or just getting out of high school at the time. And my mom had worked in retail. So this was something that was very foreign to us. And I use this I use this story all the time and I use this perspective because as we go out into the community until today, we meet a lot of people on the island that see this as a very foreign concept. Why would you need to have a mobile clinic? Why do you need to provide free services for people and XYZ? And I'll get a little bit into that later on, but that's how the organization started. We had our first mobile clinic outreach at Paradise Fitness in Agania, and we worked with volunteer doctors and nurses from the community that were just kind of like my dad's friends. And we also partnered with the public health immunization department, and they came out and provided vaccines. And we serviced over 200 patients that day, and everything was completely free. So it was really awesome to see the community come out together to provide these kind of services. But it was also very pivotal for us to see that there was such a need on the island. And so just a little bit of a bit of an idea of what our organization has done so far as of the end of the third quarter of this year. So we have serviced 18,207 people on the island, providing the different services from our organization, and 14,293 of those people have received specifically medical care. 3,914 people have received our program providing Kinder Days Ahead. And so this is a social and emotional wellness program that we had that started from the governor's education stabilization grant. And we went out to the public schools and we gave these lessons and talks to the students to help them build their resilience. We've had 93 medical outreach missions across the island. And we have now 6 programs that work together to provide access to care for our underserved population. We've had over 300 volunteer nurses, doctors, other medical professionals, and just lay people volunteer with our organization to make things happen. And then it all works under one organization. And so a little thing that I didn't get to mention earlier, we weren't a nonprofit organization till 2017 officially, but we had not gone out for any grant funding or public support until 2023, which started from the Governor's Education Stabilization Grant. Okay, next slide. And so I'll just talk a little bit about the programs that we have. So the primary program that we have, and the one that started our whole organization, is the mobile care clinic. And so we started with a 2-room mobile clinic, and we've brought it out to all the different villages in the island. But this has kind of allowed us to jump off into opening our stationary clinic, which is now in Tamuning, and we're open 6 days a week, that we have a regular staff who are available to take patients. But we also have now added another second mobile van, and then we also provide transportation services. So bringing the mobile clinic out into the community has helped us address some of the challenges, which are transportation, cost of service, because when we go out to the clinic, to the village, we don't charge for the services that we provide. And then also it allows the communities that we work with to be a little bit more welcoming to services. It's kind of like, let me come into your place and let me work with you, as opposed to just kind of sitting in a room and saying, I'm waiting for the patients, but they're not showing up, because these are patients that people that otherwise wouldn't have gone to the doctor for preventive care. They would kind of just show up at the emergency room when it's too late. And so these are our providers in our clinic. We have Dr. Ramel Carlos, who's a neurologist. He's our medical director for the Mind Care program. And so it's a psychiatric portion of our organization. And now we have a full-time board certified psychiatrist as well on the second level, Dr. Danny McClure. So they work together to provide psychiatric care, but at the same time, we have innovative technology that we've brought to Guam and kind of increased the access to psychiatric care. And then we have Dr. Dolores Lee, who's a family medicine doctor. She's our medical director. We have Dr. Sylvia Cruz, who is an OBGYN, and then Dr. Gabrielle James, she's our pediatrician. And then we have Banwar Kiawit, who's a family medicine nurse practitioner. And so if you just kind of, we can go up again. We can kind of take a look and sometimes people will say, you guys are kind of all over the place. But when we look for providers, we really look for people or for specialties that we see are lacking on the island. And so there's a big lack in psychiatric care on the island, a big lack in OB, obstetrics and gynecology. People are always having kids, and then the kids live. And so we need to take care of them and have pediatricians as well. And then we have family medicine who kind of takes care of everything from beginning to end. So we really try and address those gaps and be very specific in what kind of providers we bring. And then just a little look at our executive management. You can take a look at everyone there, but I'll just point out Dr. Zeni Ascension Nash. She's our CFO, and she's amazing. She joined our organization a little over 2 years ago, and she's really helped elevate us, get us clean audits, and allow us to go out for more grant funding. So the next program is the Hinemlu Para Ifamalawan program, Healing for Women. And last year, we were recipients of the Guam Cancer Trust Fund funding. And so our organization had put out screening information, education, and then we also did cervical cancer screening and treatment. And so unfortunately, at the moment, it's not been refunded by the Guam Cancer Trust Fund, but we still provide obstetric and gynecological services, and we still help women address these kinds of concerns with cervical cancer. Next. Our patient navigation and financial assistance program, which might be possibly the most difficult program for us, but it's also very important. And I'm sure everyone here works in a sense, understanding that patients come with a lot of challenges. So in patient navigation and financial assistance, a lot of the time we're working with patients who come in and say, I don't have my kid's birth certificate, or I don't have an ID. And we'll tell them, we kind of need a form of identification to see you as a patient, but let's go and figure out how do we get that. Sometimes we have to work with consulates because they have to go out to the outer islands, or we have to call different people in the government. And we always tell people we're not the government, but we'll try our best to help you and get these documents that are important for them, not only in the sense of being seen in our clinic, but really everything else that they need. And then another big portion of this program is specifically helping people get enrolled with Medicaid. And so we have probably 10 Medicaid applications come through our door every week, because people come in and say, I don't have insurance. And we'll say, well, do you work? No, I don't work. Then why don't you apply for Medicaid? Because we already know you would probably be eligible for it. A lot of these people are COFA migrants, and sometimes it's just knowing where to go and how to get through the process. We have people in our office that are able to walk through the whole application process with them and tell them what kind of documents they need to be eligible. And we'll help them and work with Medicaid and call to get the application sent through. And then our prevention and education program. Through this program, we provide talks, educational talks, whether it be through for mental health, behavioral health, or also just other medical specialties that we're lacking on the island. We've brought in different specialists in dermatology, cardiology, also people who specialize in autism, pediatric autism. And most recently, we brought Kevin Hines, who was a suicide prevention speaker. So he's one of, I think, 38 people who had jumped off the Golden Gate Bridge and survived. And so when he was here last year, he was able to go to, I think, 14 different groups of people on the island. He also had a public event where he just kind of talked about his experience and providing a little bit more mental health support and hope for these people who are probably also considering suicide. And then our CARES movement, like I had mentioned before, is a program that started through the Governor's Education Stabilization Program in 2022. And through this, we went to 4 different schools, elementary through high school grades, and we provided different tiers of behavioral health education and support. And we had serviced over 4,000 people, and we were able to see at least a good portion of them were able to go and get a higher form of intervention care through the program. Next. And our Mind Care program, this is the program that falls under our psychiatric care. We had brought a machine, it's called TMS. It stands for transcranial magnetic stimulation, and it's an FDA-approved treatment that's non-chemical and non-invasive for different psychiatric indications such as depression, anxiety, OCD, smoking addiction. And so this is one of the tools that our psychiatrist uses in the treatment of his patients. And so patients kind of come in 5 times a week for 3 weeks at a time, and they're able to get this care. And it's supposed to be a different tool, as though many would use medication or psychotherapy, but sometimes people become drug resistant and they don't want to take medication. So this is a nice alternative that we've been able to bring in. We're the only providers on the island of this care, and we're very happy to now tell people that it's covered under Medicaid too. So we're very thankful for that. Next. And then just to look at our patient demographics, our ethnicity, majority of our patients are still Chamorro and Filipino. And then the next largest group is Chuukese, and we have different, the different Micronesian islanders come in. But when you put it all together, this is exact data from our electronic health record. But when you put it all together, after Chamorro and Filipino, the largest population that we see are COFA migrants. And with this population, we have a lot of challenges, not only in language, but also culture and beliefs. And so providing medical care to this population has been a struggle, but also a lot of enlightenment for our organization and other community groups that work with us, because we're able to now talk with our patients and ask them, why has it taken you this long to come to the doctor? Or what can we do to make it so that you can keep coming, and understanding the importance of continuum of care and things like that. And so we really focus on being able to provide access to care for this community, because they're also one of the larger communities that show up in the hospital sometimes at end of life or at end stage of the different chronic diseases. And then patient village, we still get majority of our patients from the north and central of the island. We're not too sure yet if this is correlative with just the population or the access of our stationary clinic now. But seeing that we get patients from all over the island, it kind of helps us explain to people in the community and also funders that people all over the island need access to this care. And we try to bring the mobile clinic out into the areas where we don't see as many patients on this chart, so that we can bring the care to them. And our patient insurance, which is also pretty important for this group. So our largest population of patients have Medicaid insurance, and the largest population is self-pay, meaning they don't have insurance. And from that population, a very small portion of these people are actually ineligible for Medicaid. The other larger portion is just people who haven't gone through the application process. And sometimes we do lose them to follow up because they haven't gotten all of their paperwork to get the Medicaid application. But there are a lot of challenges with that population, the self-pay. So hopefully over time we can see that self-pay number get smaller, and maybe the Medicaid will get larger. And then we have a lot of Medicaid, and then we also accept all the other private insurances on the island, and as well as TRICARE and Medicare. And then, so the other thing I hadn't mentioned about our clinic operations is that we also offer a sliding scale discount program for people who are ineligible for Medicaid, but then they make too much money to be eligible for Medicaid, but they still can't afford sometimes a $300 bill to see a doctor how many times in the month. And so we work with them to provide discounted rates. And then the patient age range, majority of our patients are between 18 to 64 years old. And then the second largest population is the adolescents, because we see a lot of kids who come in just really for the school physicals. And we usually have these kids come in at this time of the year. We have so many kids who are coming in to see our family medicine providers because either the school kicked them out or they're about to be kicked out. And so even 7 years later, we're still doing this catch up as opposed to doing preventive care and having kids come during the summer before the school year starts. And then just to look at our funding sources. So program income is 60%, and then grants 30%, and then private donations is 10%. Next. And then just to look at some of our partnerships, we've partnered with different government organizations as well. So the first one is the TB Elimination Alliance. We were a mini grant recipient, and this is a grant funded by APCHO by way of the CDC to provide TB education in the community. TB is still a very prominent disease in the community and predominantly with the people that we service. And so bringing education that's culturally aware, that people are culturally aware of, is really important. And then the other program is the Global Partnership for Zero Leprosy. It's another funding that we got, and we worked in partnership with public health and other community organizations to provide a roadmap to eliminate leprosy on the island. So by 2027, we're hoping to be able to start work on the zero leprosy plan. And then by 2030, we're hoping to eliminate leprosy. And then we are also providers with the public health vaccines for children and the vaccines for adults program. So we can provide vaccines at no cost to those who are eligible. And then just more pictures. You can scroll down, just more pictures of partnerships. We've received 2 vans from the Church of Jesus Christ of Latter-day Saints, so that we were able to have another mobile clinic van, and then also another van that helps transport patients around the island. And then now we're also designated as an NHSC, a National Health Service Corps clinic. And then this is Dr. Zenny's, thanks to Dr. Zenny, we've had 2 consecutive year clean audit findings. And then just more pictures of our activities, our outreaches. We go out, especially after the typhoon, we had a large operation that we had so many volunteers and so many donations that came through our organization to go and provide help to the community and those mostly affected. And that is pretty much the end of my presentation. Here's a link if you want to learn more about our organization. Thank you.
Thank you so much, Ashley. And I just have to say, like, I remember we had only just first met like a few months ago, but I remember like a decade ago when your dad was running, you were like on all the billboards around the island. So when I was like, oh, I get to finally meet you. But I actually, Senator Rodriguez has been doing, I'm not surprised that your dad started Todo Guam, because years and years ago, like when I was a college student, he was running an essay contest between Guam Community College and University of Guam, where he said he'd pick a student who wrote an essay on healthcare and he'd let them intern with him, and I ended up getting selected for UOG. But that was it was incredible to see your dad in action, and just how passionate he was in the healthcare field. Even though, like you said, he was not an MD, didn't have a medical doctor background at all, but he knew how to. You could tell that he was genuinely passionate about it, and even taking a delegation from Guam to the Philippines, where he somehow coordinated us to meet with President Aquino, who was the president of the Philippines at the time, and meeting with other doctors at St. Luke's and other healthcare professionals, and being able to bring that knowledge back to Guam. And so it's so incredible to see your dad and his team doing great work. And of course, Dr. Zenny, who's also a Rotarian. I don't know what our Rotary Club would do without you. So I just love that, to see you doing this great work with Todo Guam. So thank you for that. And without further ado, I know it's time that I wanted to just segue to public health, because I don't know what we would do without you all. Really, everybody on island is aware, but I wanted to be able to take this time to talk about some of the programs that you all have available, the resources that you have available. And it's just, and if you could go and just do a quick introduction, since I only ended up with one bio, but we'll start with Chris. I haven't seen Chris in like 10 years, so the fact that he's standing in front of me right now is like nice surprise. It's great to see you, Chris.
Hi, everybody. My name is Chris Serla. I am the Human Service Program Administrator for the Bureau of Healthcare Financing Administration, also the Guam Medicaid.
Half a day, everybody. My name is Renee Carpella. I'm a Claims Processing Utilization Review Officer within the Department of Public Health and Social Services under the Division of Public Welfare in the Bureau of Healthcare Financing. I saw your eyes get big back there. You're like, how many titles, right? So I'm glad to be here. So thank you for the invitation.
Hi, half a day. Sorry, I have a little raspy voice, so actually it sounds pretty good with the mic here. I'm Christine St. Nicholas. I am the Bureau of Healthcare. I'm sorry. I'm already talking about Chris. See, we're already getting confused. So I'm the Human Services Program Administrator for the Bureau of Economic Security. So I oversee the SNAP, the Medicaid, the MIP, the cash assistance, and the employment training programs under public welfare. Not a lot at all. I've been with public health for 26 years. I started off as a social worker with medical social services, which was special healthcare needs, and then moved on until the employment training programs, and then now I oversee the entire bureau. So I've only been the administrator for about maybe about 3 years, but with public health my entire life, basically. I like to stand, so sorry. Oh, I pressed the button really quickly. Okay, he said to press this button. Oh, there we go. So we basically I know towards the end of the day, so I hope to try to keep your attention. So we offer these public assistance program, which is a supplemental nutrition assistance program, also known as SNAP, Medicaid, of course, medically indigent program, and the different cash assistance programs that we offer. So in terms of our staffing, I have a total of 94 people on my staffing pattern. I'm sorry, 95. I've got 40 vacancies. I have about 55 of those positions filled. So I'm at 57% capacity in terms of staffing. And that's all the positions in case you want to know what's open. So the Supplemental Nutrition Assistance Program, as we know before, was also called food stamps way back when. And again, this provides low-income nutrition assistance to eligible low-income individuals and families. So it's basically to help people that have little or no income to provide for their families and no food, and especially for a healthy diet. At least we hope a healthy diet. That's our intent. Who can receive food stamps? I'm not going to go through the whole entire thing, but basically, if you are a U.S. citizen and you are lawfully a present non-U.S. citizen, such as qualified alien, which is a category that we have under our program, it's 5 years of residency. They have to have 40 qualifying work quarters in order to meet eligibility. Children under 18 years of age who are lawfully reside in the U.S. So again, a qualified alien is defined as a non-citizen who has the immigration status of legal permanent, which is LPR, asylees, and refugees. We get very, very rare of asylees and refugees, very rare. So we look at non-financial, which is your citizenship, of course, your residency, social security numbers, household compositions, work registration, because like I did mention, we do have employment training programs that are tied into our public assistance programs. And then financial, we'll look at the earned income and the unearned income. So I talk about unearned income. This could be like child support or money they receive from their retirement or money they receive from family and friends. That's considered unearned income. So SNAP requirement, this is always a question, will I have to provide a social security number to apply for SNAP? You have to provide a social security number. So if you are helping people with their applications, the number is required, but they do not have to submit the card. And that was one of the changes that we had made. The only time that we ask for the card is if there's a discrepancy in our system, if it's showing that the number is not matching with the current name on the system. Not all members of a household have to take part in the program. So those who do not want to receive SNAP, so if you have a family who's living with a sister, as an example, that sister doesn't have to apply for SNAP if they're separated. So our application is we have basically 3 satellite offices. We have the Northern Public Health, and I'll show you a picture of that later on, which is at the Northern Regional Community Center up in Dededo. We have our Southern, which is at Inarahan Public Health. We're also at the Rancare in Tumuni, which is the 2nd floor. And we also have a satellite office at Castle Mall in Manila. So again, we also have it on our website. You can download the application. And they can fill it out, they can print it, they can actually email it as well. So again, they just complete the application, make sure their documents are submitted, and then when we do receive it, we'll assign it to an eligibility specialist. So once approved for SNAP, the benefits are basically certified for 12 months. But if you fall like in the disability category or elderly, it goes to 24 months. So you're certified for basically 2 years. Then you'll get a notice of action about your benefits. Then you'll be given an EBT card, which is the Quest card they use at the grocery stores to SNAP for the benefits. And we have 2 issuance centers, which is at Northern Public Health and also at Rancare. So for renewals, again, we do have a standard renewal form that is basically mailed out to all the clients. It's basically pre-filled so that the information they presented before will be on that form. And all they need to do is indicate if there's any basic changes to any of their family circumstances. And if so, then they would just indicate that and submit their documentation. There's also change report forms and there's periodic. So the periodic only involves the SNAP program. So this is where they can report certain changes within 6 months of their certification period. So this is what can I buy with my EBT card? So of course you can buy dairy products, honey maple products, all of these different food products, but you cannot buy alcohol, you cannot buy hot foods as well with that product, with your card. So anyone who gets an EBT card, especially if they're new, they will go ahead and give them a brochure about what they can and cannot provide or buy. And sorry, it's really, really small here, but this is the current income guidelines. So every year, FNS does provide us the income guidelines. So we don't make it up. We don't decide what is the income threshold. So for example, and this also has the Medicaid as well on here. Does this have a pointer? Just checking. Oh, yes. Okay. So for example, for household size of 3, the income limit basically is 3,380. Now, this is based on gross, okay, not the net pay, unfortunately. And then if they qualify for household size of 3, their benefit basically will be $1,132 a month. And for Medicaid, the income criteria was 2,714 in terms of the income. And then MIP is always lower. But whenever we assess people for medical insurance with Medicaid or MIP, we always look for Medicaid first. But this is the income. And again, this is also available on our public health website. So in Medicaid, there's basically 2 different types of categories. It's called categorically needy, which is those that are age 65 and above. They're blind and permanently totally disabled, and also pregnant women. And then the other group, it's called the alternative benefit plan, which is childless adults from the age of 19 to 64. So anyone who falls under this category, basically it's vision and dental, right, Renee, they're not eligible for. In order to get eligible to move from that group to that group, then they would have to submit what they call as a medical referral form, which will take that kind of group away, and they'll be eligible for those services. So again, we have the Medicaid. Again, those are basically under cash assistance. I used the mouse, didn't I? Sorry. Again, so those are under cash assistance, our TANF, our old age assistance, our aid to the blind. They basically fall under the Medicaid program. MIP, again, is 100% locally funded. All right. And again, those are who are, they have to, so this MIP, you meet a residency requirement of 6 months. And then if you're not eligible for Medicaid, then we put you under MIP. So cash assistance, again, we have temporary assistance cash to needy families. And then we have aid to permanently and totally disabled. We have old age assistance, aid to the blind, and general assistance. So temporary assistance, the TANF program basically has a work requirement attached to that. So we engage people in our employment and training programs for that. And then this is the contact person. So once an application is processed for cash, an automatic referral will go to our work program section, or they will get invited into an orientation to tell them about the services that we offer. So we provide, and I'm getting way ahead of myself here. So we provide basically employment training program services, transportation allowance. We give up to $100 per month for transportation. We give work-related. So anything from getting their car serviced to driver's license to getting a medical checkup that's not covered. If they're not under Medicaid or TANF, then under TANF, they'll be able to get reimbursed for that. And it's about $400 a month. I'm sorry, a year, within a year. So it's pretty open to what we can reimburse. And then for our SNAP, so Patrice is basically our training program coordinator for the TANF program. For our SNAP program, that'll be Alyssa and Kanko. And this is her information. So kind of give you an idea as to how much assistance we provide. So an average of SNAP assistance that we spend benefits is like 10 million, about 10 million. Average monthly cases, about 13,000 cases, and about 34,000 members that are eligible under SNAP. Under cash, about 209, maybe 1,000, about 1,200 cases, and about 1,500 members. And then for Medicaid, we have about 14,000 cases, but about 34 to maybe sometimes 40,000 members that are eligible for Medicaid. And that could be, and the number could be higher if we had more people, let's say from the COFA side, that may not be aware of our program to increase this number. And to give an idea of our application, so we processed about 20,000, about 21,000 applications and about 13,000 change reports from the period of October to last year to just last month. And then for that same period, we basically got a total of 26,000 applications and averaging about 2,000 applications per month. And that's a lot. And that doesn't include the phone calls they make or the interviews that are conducted. Just to kind of give you an idea of what the stats are. So these are the locations. Now I know it's green up here, but recently it's now blue. So it's the blue building now. And that's Southern Inarahan Public Health. And we're on the second floor, which is also WIC is right across from our office. Then of course the RAN Care building. So we're sort of like on this side here, the second floor. Bureau of Healthcare Financing Claims Office is on the third floor on that side. And there's signs everywhere, so you shouldn't be able to get lost. But if you do get there, there's only one elevator towards the back, just for your information. And then we have the Castle Mall here. That is part of our drop-off center. That's also where our employment training programs are situated. But these are our phone numbers. I just want to say that our northern and southern phone numbers do not always work. It does sometimes, it is honestly the weather. Our phones that are there are very antiquated. They're not up to date until the wires all get changed out. So, and then of course our RAN Care and then our Castle Mall building. One of the things that we did do differently is, so I'll just tell you that my whole intention with the program was to move it to modernization, right? It's get away from the paper and how do we make things more accessible for our families? So one of the things that we started off with was a mybenefits.guam portal. So clients who are under SNAP or any type of assistance, they'll be able to register, they'll be able to see their information on their case, their notices, their renewal forms, and their documents. So if for some reason they're missing an ID, if Ashley has a client who is missing identification, and if they have this portal, they may be able to also see that documentation. So again, that's just one of our tiered levels. What we're also looking towards is increasing our online access by working with maybe like a new vendor for online application. Our vision really is to ensure that people have access wherever they go to apply. So whether it's kiosk at, say, Payless or kiosk at the mayor's office, that is kind of the vision that we're driving towards. Our directors also being that we're pushing for. But again, to bring the services to people like, Ashley's Foundation, where they can access services that they need. So I'm basically from the Bureau of Economic Security, so I handle the eligibility portion. But okay, so when they become eligible, what services are available for them? And that's all handed off to the Medicaid team.
All right, thank you very much for attending this module for the Guam. This is for poverty in Guam and the Pacific. Perfect. So right now, what I'm going to go ahead and do is I'm going to dive into the Guam Medicaid and MIP program. You can go ahead to the next slide. I don't have the clicker. Hold on. Let's see. Okay. Let's see if I know how to navigate the clicker. Is it going to go through, or am I pressing the wrong button? Okay, perfect. So today's agenda, we're going to go over the missions of the Guam Medicaid and MIP program. We're going to go over the program sections, because within the Guam Medicaid, there are different sections. We are going to go over the benefits and limitations. So just like Christine St. Nicholas went ahead and mentioned, she does the Bureau of Economic Security, which translates to layman terms as the eligibility, determining if somebody is eligible for Medicaid. What we will do at the Guam Medicaid section is we would determine what benefits are applicable to them based on their eligibility criteria, as well as the limitations. I'm going to go ahead and take this opportunity to educate just the general public about some of the forms that we have, because the more people that know about the forms, maybe you might be able to assist a loved one or even able to assist a physician in the event of whichever field that you're in, whether it's healthcare or through advocate organizations. So we'll go ahead and dive into that. I'll go ahead and highlight where our locations are, similar locations to where Christine's offices are. We try to keep it in sync since we're basically sister bureaus. Our website, you'll get a little brief of my bio, so I didn't want to bore you in the beginning, but we'll dive into who I am, and then contact information for the Guam Medicaid organization. Sorry about that. I know I did this right the first time. Okay, there we go. So our mission at the Bureau of Healthcare Financing Administration is to administer local and federal healthcare programs to assist low-income individuals and families who are underinsured or have inadequate insurance coverage, and ensuring that the quality of healthcare is available and accessible, both on island and off island, because we also have an off island program. All right, so the program management section is one of our sections under the Bureau of Healthcare Financing. The program management section is responsible for the financial and program management support. They develop, monitor, and evaluate the program. They do state plans, policies, procedures, operations, manuals, and then they also conform to the rules and regulations within Guam. Now, this is the fun part. If anybody here does medical billing, doesn't look like it. But if if you were in the medical billing field, this is the fun part because this is the operations section. This is where the grind really happens. The wheels turn to get those claims that are submitted to our program evaluated for the medical necessity, evaluated again to determine the right program, the right eligibility criteria, and then paying those providers. Who are those providers? Those are doctors, not doctors like Dr. Jones, but doctors like the clinic physicians. So at the operations section, we oversee the utilization and control, claims processing unit, EPSDT, the Medicare buy-in, off-island referral, coordination, and then the claims intake and filing. We do services that span from inpatient care, which is our hospital services. We do services that span to pharmacy services, which we're working really hard to also modernize. And that is with the great support of our director right now, Teresa Ariola. We also have services for our outpatient services here in Guam and off island. And then we also have limited ground transportation services. At this time, we are looking at expanding and identifying where the needs are for those in our community. Because one of the things I want to highlight on this slide is one of the main reasons why individuals are unable to get to their appointments is because the lack of reliable transportation. So that's a discussion that we can dive deeper into later. Moving forward, we do have a quality management section, and this section does an evaluation of all the benefits that we issued out to kind of figure out and make sure that we're doing the right thing, and going the right path. And this quality management section is responsible for maintaining and developing the quality management and operation and program management section to benefit coordinations and prior authorization for Medicaid fraud, waste and abuse, and Medicaid our control unit. We do prior authorizations for adult services that meet the criteria. And then we also do prior authorizations for children's services, but hopefully we can kind of reduce that so the streamline of access to healthcare is a lot easier to navigate for those who need it, especially young mothers. Okay. Now, our benefits and limitations. The Guam Medicaid and MIP program is dedicated to providing access to healthcare in Guam and off-island through services that are medically necessary. You keep hearing me say that because a lot of services out there, depending on what kind of doctor you talk to, they're like, it's medically necessary. But when we're talking about medically necessary, we're talking about life-saving procedures or situations where an individual's life is at stake. We also have limitations for the program because we had to do this very challenging balancing act. Because Guam Medicaid funding is limited, we want to go ahead and make sure that we're sustainable. We're here 10, 20 years down the road. In order to do that, we had to balance out what kind of benefits we can issue versus what kind of limitations we can kind of not really compromise is not really the word, but what we can consider to be maybe a more reasonable approach, such as preventive care services. Of course, we're going to want to push out preventive care services rather than pushing out more off-island care services, because at the time that the patients need to go off-island, they're more than likely in a state where it's a very challenging situation for their health. Okay, so we do that through preventive care services, prescription of drugs, and then issuing durable medical equipment as long as it's deemed medically necessary. Another benefit and limitation that I want to go ahead and highlight are inpatient services. We do have limitations on how many days somebody could stay in the hospital, depending on why they're there, their diagnosis code. Outpatient care services, of course, depending on the type of diagnosis code. So typically we kind of go through all of these different bullet points on the criteria that is needed to determine if it's medically necessary and if it fits within the program that this recipient is under. So just because you hear Medicaid and MIP kind of being highlighted within Medicaid, there are different programs under Medicaid. It was shown on Christine's slide. You have Medicaid for how many, Christine, do you have? How many different programs just under Medicaid that we categorize? So there's quite a few. And this is all determined on age, income, and so forth. So diving a little deeper into that, we have Medicaid, ABP, and the MIP program. The Guam Medicaid program reviews the medical necessity for each case, the justification for durable medical equipment, which is what I want to highlight today, and other medical supplies impact the medical notation from impacted by the medical notation from licensed medical professionals. Not all requests are granted for approval, but the Guam Medicaid and MIP program does provide active fraud, waste, and abuse screening through each request made to the prior authorization process. And this prevents delays in treatment through our standardization for our forms. And I'm going to go ahead and go over what I really want to educate you guys, because you guys might be able to help somebody else. Our durable medical equipment, supplies, and so forth are typically covered for baseline equipment. Not really electric chairs with like the little hub lights and, the spinning wheels. We don't do that. We only stick to the basic. So this is one of the forms that I want to go ahead and highlight, and this is actually a BES form. This is our Certificate of Medical Necessity, Durable Medical Equipment, and Supplies. The reason why I want to highlight this is because this is actually a 2-page process. This says that a prior authorization request for durable medical equipment or supplies, the information will be required for coverage review, and failure to provide all the following information will result in denial of the request. And let me tell you, have you ever been in a doctor's office and you see those doctors charting away and they're like not completing the form? Yeah, we try to encourage them to complete the form because it would streamline the process and it would allow us to do our job to determine if there's coverage. So a lot of times clients are calling in and they're like, okay, how come it's not processed? It's been 2 days. It's been this many days. We're like, well, is it okay if you could follow up your doctor? We kind of gave them a little heads up that it needs to be complete. Okay. That's what they teach you in school, right? Yeah. To submit things complete. Oh no, why am I going backwards? Okay. So this is another form. This is a new form that happened this year. We were trying to identify a way to standardize the prior authorization requests. And the reason for that is we were having different providers have their own approach to how they submit requests. I want a prior authorization for a wheelchair. I want a prior authorization for an annual physical. I want a prior authorization for sterilization. I want a prior authorization for a pap smear. And everybody was just doing it the way they wanted. So one of the things that we identified is to streamline that and to make a standardized form. And we try to make it as short and sweet as possible, but of course, still getting the information that we need to determine what is medically necessary. So you have patient information, provider information, and then it kind of breaks down into what kind of services are you trying to request for? Are you requesting for a radiology type of service, or MRI, an X-ray? All of those could be highlighted by your doctor, and they'll know what to put there. Not the doctors, the nurses, definitely. Okay, again, sharing some locations. The Guam Medicaid and MIP program is located at the Rancare building, same building that she was showing, but on the 3rd floor. There's a little public health sign, I think, that survived the typhoon. If you go a little further, there's Senator Joe San Augustine's office. I don't know if he'll still have that office, but that's there. Hint, this is his car. And then we also have the Castle Mall. Our rooms are room 5, 6, and 7. 5 is our child prior authorization and Medicare buy-in section. I want to say 6 because 6, we kind of just open that up for off-island referral to make it easier. And then to also allow our clients to be open and talk about maybe some of the issues that they have with off-island, separate from the prior authorization patients. And then we have our adult prior authorization section in room 7. So you have 3 offices at Guam Castle Mall. So you can come visit us. I'm there, by the way, if you're ever in the area. We also have our website. Under our website, there's all these different tabs and they have drop-down menus. I introduced that I'm under the Division of Public Welfare within the Bureau of Healthcare Financing. And then this is a really great resource tool because it tells you the announcements and notices, policies about our program if you wanted to dive deep in that, applications and forms. And there's just a whole wealth of information here that could be very useful, especially if you know a provider who wants to come to Guam and open up their own private clinic, like an OBGYN. That would be a very great tool because we also have forms for new providers because we also process our own provider network. So again, my name is Renee Carpella, over 13 years with the Department of Public Health and Social Services. I take great value in this kind of initiative to address the poverty needs or the individual needs for people in poverty because we all know how challenging it can be here. And then this is some of our contact information if you wanted to call our RANCare office. Let me try to scoot this over. No, I don't know how to scoot that over. Let me finish the phone number for you. So our RANCare office is 300-7330. And then our Castle Mall is 735-7470. Don't worry about it. There you go. So just in case you want to, but any questions? No questions, no concerns? Okay. All right. So thank you very much again for your time and have a great day. Oh, absolutely. Mm-hmm. Mm-hmm. Well, is it okay if I give you the mic? That way everybody.
Yeah, just so your prescriptions that you cover, I don't know what your formulary is, but they say, especially like some of the insulins, you don't cover pens or things like that, and people who with diabetes who have complications with their eyes because of diabetes, they still have to have the vial and needle method, which is it could be dangerous for them. They can't see numbers very well, and these things are very small. Because I told them go get a pen, and they said it isn't covered under Medicaid, I think. So I couldn't believe it. So that's one of the other things. And another thing was you cover glucometers and strips, right? And well, one agency told me, they're a DME company also, and they cover up to 80%, but the Medicaid program didn't want to cover the other 20%, so they were struggling with that as far as like diabetic supplies. So that's what I run into. And then and the other one is your forms are just so voluminous. So when I saw them, I said, holy smokes, who has time to apply for MIP, all those programs? Yeah, and I was just like, what? I don't have time. I'm seeing some, trying to, I think when we go out to screening, so I need to have someone from your department just sit here and I can just refer over here because I can't, just go through this especially if you have to see people who need, medical services or education related to management of the diabetes or hypertension or whatever, cholesterol. Yeah, it was just like, so that's another thing. I think you have to coordinate with like screening teams and have someone, a social worker out there to help because it'll move things faster. And I think it's daunting. People don't like filling forms, neither do I. So FYI, just thought I.
Well, she brings up three very valid questions, right? The last one really being a Bureau of Economic Security question. However, I do want to let you know, Christine, you could stop me anytime, but the programs are federally funded. So these are federal requirements that we also have to adhere to. So all of those elements that we have, which we've tried to take some initiative to kind of downsize it. If there's some announcements, I know that for certain programs, the mayor's verification is no longer needed. So that kind of helps eliminate one process. So there's initiatives internally that we're trying to do to reduce the burden of an applicant. So that's your last question. Okay. Unfortunately, the standard application is the requirement from the grantor who actually gives us the funding to do the program and to fully put it in full throttle and let the recipients or beneficiaries get the beneficiaries the benefits that they are eligible for. Now, you also mentioned something about insulin. I want to clear the record because typically, and this is why it's very important. Can I borrow the clicker real quick? And you're talking about the 17-page application fee for public benefits. However, if we go back, a lot of times, and I can guarantee you this, a lot of times, this is not really the form, but let's say this was the form for, I'm sorry, this is the form for a glucometer. Oh, okay. So a lot of times the forms, or a lot of times a patient is denied insulin is because the information that is provided is not complete. It doesn't give the diagnosis, it doesn't give the depth of the complexity. Like you mentioned, somebody could be blind, having a viral administration of insulin could be dangerous. It needs to be stated here. It needs to be stated here because we actually do cover insulin pens. And then your first question, real quick, because I only have like 30 seconds. What was your first question? Oh, okay. So we're talking about glucometers. So before, in previous months, there was a shortage of durable medical equipment suppliers that were Medicare certified. So it wasn't that Guam Medicaid wasn't able to pay the 20%. It was, I'm not trying to put anybody under the bus, but I'm only here to state the facts. It was a lot of different issues. It was not billing properly. Maybe what happened and what I have seen in my own process is they billed Guam Medicaid first, which we are actually a payer of last resort, when they were supposed to bill Medicare first, then get an explanation of benefits from Medicare, and then submit that to us to then pay the 20%. So it gets a lot deeper into that, but those are valid questions, and thank you very much. I think I ran out of time, so I'm going to go ahead and put my contact information. If you have any questions, please feel free to email. You can email the OIR because I oversee that. OIR@DPHSS. But thank you again, guys, for your time.
So much. Thank you again. This was such an important session for us to have as healthcare and medical impacts to all of us. And just being able to have access to quality care is, it's just a basic right, in my opinion. And we can definitely do better. And so thank you so much for the work that you do day in and day out. And another round of applause for our speakers. Just really grateful for you all being here. Thank you so much. If you all could join us, we will be going back to the main room for our closeout session, and that will call it a day. And hopefully that you all join us for the art reception. You will notice that before, if you do have to leave, like right now, we do have the bidding sheets out next to the artwork now. So if you'd like to place a bid, again, all the proceeds are going to be donated to the Guam Homeless Coalition to support their efforts. So you'll see artwork done by local artists around in the hallways out here, and please stop by our community vendors. Well, thank you so much. Please join us in the main room for a closing session.